Hi, my name is Jennifer McCormick, and I'm an associate professor at Penn State University in the College of Medicine's Department of Humanities. I'm going to take the next few minutes to talk to you about an article that's going to be coming out in one of the upcoming issues of Mayo Clinic Proceedings that my colleagues and I put together. The article's title is Medication Nonadherence. There's an app for that. So basically, it's really interesting. There are these new technologies that are coming online. For example, a pill that when ingested will transmit data to different people, to the physician, to other third parties. There are also bottle lids, pill bottle lids that will blink and collect usage data that is then transmitted again to the physician, even the pharmacy. And the goal of these is really to help improve medication adherence, which is quite problematic in our country. So what we did was we took a look at what technologies are out there, and then using an ethical and social policy lens, kind of did a little bit of an analysis. And data, as I said, data show that medication non-adherence is a problem, and so anything that may help people remember to take their medication, especially people with really complicated medication regimes, would definitely be beneficial. The goal is these technologies collect the data is transmitted to maybe another family member or a physician so that they can track the use and then send friendly reminders if the individual is not taking the medication as prescribed. But what's interesting is that studies also show that cost is a barrier to medication adherence. In fact, some people will skimp on medications or simply not even fill prescriptions because of the cost. It's this whole issue of having to choose between putting food on the table or getting your prescription filled. And so what's important to consider is that if incorporating these technologies into healthcare, into medicine, medical practice, if those actually increase the cost of medication, then we might end up with kind of in this paradoxical situation where something that was intended to help people take their medication, remember to take their medication, will actually hinder them to take their medication. And this is particularly important to consider with people who don't have health insurance or are already struggling with access to medications. So a really kind of intriguing thing to think about is what happens with all the data that are collected by these technologies. As I mentioned, the data are intended to go to an individual's physician or a nurse practitioner or a family member to help them remember when to take it, or even to an individual's pharmacy so that they kind of get an alert that, oh, you need to refill your prescription. But the bigger issue is who else is using those data? What happens to those data? How are those data being used? And we're suggesting that it's a really important question to ask is, toward what end will these data be used? I mean, we've got to think about all the different stakeholders in healthcare and medicine, medical practice. There's patients, there's physicians, clinicians, there's health systems, there's insurers, there's pharmaceutical companies, and they don't often all align, right? And sometimes they can actually be at odds with each other. So, what we're suggesting is as these technologies become more prominent, if indeed they do, but becoming more online, then it'll be really important to step back and kind of take careful consideration of who should have access to the data? How should the data be used? How will the data be de-identified? How can we ensure that the data will be protected and confidentiality will be protected? So in the end, we are concluding that these smart technologies really have some benefit. studies are showing that they are improving use, medication adherence, and that those who have been individuals who've been in these trials have actually found the technologies to be useful. But as with any technology, there are often unintended consequences. We can only speculate at this time what those might be, and some of them may be good, but some may be bad. And so as we kind of push these technologies more into the medical practice, it'll be really important that thought leaders and different stakeholders, a variety of stakeholders, take a step back and have a real deliberative, careful analysis of how we should move these technologies into practice.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.